Good afternoon and welcome, welcome. Happy to see you all joining. I'm going to wait a few moments to allow others to join and get ready for an exciting afternoon. Good afternoon and welcome. So happy to see you all joining. We'll be starting shortly. Good afternoon. So happy to see you all joining. Thank you so much for joining us today. We'll be starting shortly. And yes, all participants are on mute at this time. So welcome. Happy Tuesday to you all. So happy to see you joining. We're expecting around 500. So looking excitedly forward to a great discussion today. We'll be starting shortly. So happy to see the Zoom room filling up with you guys. So happy you're here. You're in for a great treat today. We'll be starting shortly. Gonna give it about one more minute and we will jump right in. We have a full agenda, a lot of great content, a lot of wonderful experts for you to hear from today. Get your pens and pads and your iPads ready, capture these notes, and we'll be starting shortly. Well, happy Tuesday to each one of you. Thank you so much for joining us. My name is Elle Panye Hudson, and I serve as the chair of the Human Resources and Professional Development Committee for the Greater Miami Chamber of Commerce. I'm also privileged to serve as Vice President of Human Resources at the finest institution in the universe, Florida International University. Thank you all so much for joining us today for a discussion on HR's role in shaping the people strategy of a post-COVID workplace. As always, your time and attention are very important to us, and it's our responsibility to make sure you get a return on your investment. Today, we will not disappoint. Our topic speaks volumes to what I'm sure each of us as HR professionals and attorneys are dealing with for the past 3 months. In fact, do you ever wonder to yourself, what were any of us doing before COVID-19? I think we're probably going to have to update our resumes. Can you share that screen for me? Seriously, I do want to applaud you all for the work you're doing to guide your organizations through these unprecedented times. Today's program is going to provide great information to assist as you're strengthening your business continuity teams or working on reintegration protocols, or equally important, establishing strategies to manage your return to the future, not the past. Our panel of experts represents several industries to offer us a clear picture of how similar yet unique the challenges are that provide opportunities for us to lead in. So I'm super excited about the discussion. We can return our agenda to the screen. But before we get into the program itself, today's program is being sponsored by our colleague and friend, Rick Beasley, Executive Director and CEO of CareerSource. We're fortunate to have him with us today as not only is he the Executive Director of CareerSource South Florida, but he's also first Vice Chair of the Greater Miami Chamber of Commerce. He's an experienced executive director with demonstrated history of working in the nonprofit organization management industry, having a strong business development professional skills in management, policy analysis, organizational development, recruiting, and training. Allow me to introduce Rick to speak with you for this morning for a few moments. Rick?
Good morning, and Mrs. Hudson, it's so wonderful to see you. I haven't been able to place my hands on you, but I'm hopefully we'll be able to pound. I know we probably can't hug, but you know I like to hug you. But so good to see you. Also to Mr. Martin, it's good to see him as well. To the wonderful staff of the Greater Miami Chamber of Commerce, Alfred Sanchez and Tanya and others, you all have been doing a fantastic job of how we keep our community flowing, how we're able to assist our businesses to be able to maintain continuity, to revive our economy, to keep it thriving. And so I'm so glad that the Chamber is doing some fantastic work. And we here at CareerSource South Florida have been partnering with the Chamber through this COVID-19 pandemic issue, trying to ensure that all our businesses are taken care of as they, in some cases, have to lay off. And so some of those who are here joining us today may not know what CareerSource does. You all have seen us really focus on the employment side of how we assist those who are looking for employment and how we can help you with your recruiting skills. We also provide youth activities and services there as well of again, our tech hire program. And so I want to mention that to those listeners that please, if you have youth that are at home, have them register through our tech hire initiative. We're going to serve up to 1,000 kids this summer virtually in IT programs. But that being said, the other work that we have been working on or doing this past couple of months has focused on how we help employers re-engineer whether they're doing a layoff or whether they're recruiting or trying to avert a layoff. That's what CareerSource does. We are required by law. And so the rapid response activities that we are implementing have encompassed strategies and activities that that serve our community, that respond very quickly to help those workers that are impacted, but also those employers that are trying to maintain a workforce. So please keep this in mind. As you're looking at how you gauge of recruiting, retaining, or averting layoffs, please reach out to our agency, CareerSource South Florida. We're there to provide those assistance to those employers. We're going to launch a new initiative. We're not ready to really release it just yet, but with the Chamber, the Beacon Council, and others on how we help our small employers, but our employers, again, recruit. So I thank you all. I'm looking forward to this wonderful conversation because it is very important of how we look at our role in HR and how we help recruit a talent, how we retain talent, but more importantly, how we get our economy steamrolling back in the right direction. And so with that, again, Ms. Hudson, I thank you. Patrick, I thank you for what you all do. I'm looking forward to this wonderful session today. So with that, I turn it back over to you.
Thank you. Thank you so much, Rick. And this is our pleasure. I tell you, I miss you too, and I look forward to being in your presence again, albeit socially distanced. Awesome. So guys, we're ready to jump into today's content. I want to share a few housekeeping points with you as the speakers present. So you're all welcomed and invited to place notes in the chat area. We encourage your comments, your enthusiasm, and your compliments. However, if you do have questions that you wish the moderator to ask of the panel, please submit them in the official question feature located at the bottom center of your chat room bar. We will be recording the webinar, in which will be available on the GMCC website this week. And for those of you that may not be members of this great chamber, I want you to join me and join the chamber. Please reach out to Stephanie Parra. She'll be happy to connect you with a member specialist. So with that, here to guide the discussion and present expert information from a few outstanding voices of our day, I want you to allow me to introduce our moderator and our participants so we can jump right in. Today, our moderator is Angie Brainard. She's Executive Vice President of Talent Management for Right Management Florida and Caribbean. She's the Global Career and Talent Management Expert with Manpower Group, within the Manpower Group, my apologies. Angie is celebrating 40 years, even though she only looks 40 years in business in South Florida with the global presence in over 50 countries. We're privileged to have her this afternoon, and she will be leading the panel discussion with these outstanding panelists. Audrey Grolich, Chief Human Resources Officer for Pediatric Associates of Florida, is Florida's largest privately owned primary care pediatric practice with more than 200 providers and 34 convenient locations extending from Jacksonville to Miami. Audrey is joined by Chris Hamrick, who leads as Vice President, Chief Strategy Officer at the Hair Club, the leading provider of total hair solutions in North America for 40 years. Hair Club is headquartered in Boca Raton and has 120 centers in the US, Canada, and Puerto Rico. Audrey and Chris are joined by Melissa Martin, who's Senior Director for Global Employee Relations and EEO Compliance at Citrix Systems. Citrix is a technology firm powering a better way to work with unified workspace, networking, and analytics solution. Citrix solutions are in use by more than 400,000 organizations, including 98% of Fortune 500 companies. Audrey, Chris, and Melissa are joined by Amy D'Olimpio, who leads as the Senior Vice President of Human Resources for Regency Centers. Regency Centers Corporation is a real estate investment trust and is one of the largest operators of shopping centers with grocery stores as anchor tenants. As of December 31st, 2019, the company owned 419 properties comprising 52.6 million square feet of space. You have a power-packed panel with diverse industry backgrounds that are going to share with you today. Angie, please take it away.
Thank you very much, Alpanye. Welcome, everybody. So glad to lead this conversation and discussion with this great panel. So let's get right into it. Stephanie, if you want to go to the next slide, that's perfect. So a safe return to the office is on the mind of everyone, as many counties in Florida are slowly entering phase 1 of the federal guidance. And as an example, I know all of you are aware that just yesterday, haircuts and eat-in dining resume in Miami-Dade and Broward. And as you can see, I could use one. So I'm excited about the haircut piece of this. But not everyone is in the same place as it relates to the reopening. Fortunately, Fortunately, our businesses are in good hands, though. According to a survey of Fortune 500 CEOs conducted in the last 2 weeks of April, 92% of U.S. corporate leaders are judged to have done a good job of handling the crisis thus far. And we're very fortunate to have 4 of those leaders on our panel today. So to address the challenges of the past 2+ months, many organizations have activated a task force or a COVID response team and are now crafting the reopening. So let's go to the panel for some comments on that. And Audrey, I'd like to start with you. Tell us about your response team. Who's on it? How's it evolved? And what's your focus currently?
Thank you, Angie. Let me first just say it's really a pleasure, to be part of this panel. It's such a timely and important discussion, so thank you for including me. At Pediatric Associates, we established the end of February, early March, a COVID-19 task force that's been working together virtually since that time frame. And part of working together, we wanted to ensure that we were planning, preparing, and responding really quickly to the health and safety needs of our employees and our patients. As we're all aware, this scenario with COVID has just rapidly evolved in ways that maybe we couldn't understand. So this team has done a wonderful job of, kind of coming together, making a plan, and helping us to execute it quickly. And what we did is we wanted to make sure that the team was comprised of a lot of subject matter experts within our organization. So we have team members from our clinical team, our human resources team, our compliance and risk team, the facilities team, our technology team, and our operations team. And that team has really helped us to ensure that we were taking a really well-rounded and thoughtful approach to our work because we weren't over-indexing in one area that may be of interest to people, whether it was clinical protocols or whether it was human resources or facilities or technology. So we've taken a couple of different angles because at Pediatric Associates, we have 2 different kind of workforce modes that we operate in. One is our business office and the other is our clinical offices. So we asked the team to try to think through, how could we manage this for our clinical office teams as well as our business office teams. And what we went ahead and did is within our clinical offices, we went by CDC guidelines and we updated protocols, PPE needs, social distancing, and that has really helped us to kind of minimize the impact to our employees within that environment. We also completely deployed our business office team to our complete remote workforce, and that was a big effort for us because up until that point, we were an on-site business office. We're now kind of looking and saying, that was pretty successful. That worked for us. How can we leverage what has been happening, over the last 6 weeks and deploying that team in ways into the future? Our teams are demonstrating that they like it. They're happy with, working from home. There are teams, however, that we do need to get back into the office. So we're assessing that readiness, from not only a person perspective, their, health and safety, but also technology and office space, facilities, and that kind of thing. So that's what we're currently working on, is that assessment.
Great. Thank you, Audrey, for that description. Amy, I want to go to you next. I know that you have been a part of a team since the beginning, and you were also describing to me about your team and the playbook being developed. So can you share what's happening with your team focus?
Yes, thank you, Angie. And first, I'd like to say I completely agree, Alpanye. What in the world did we do before this? Because I feel like this is my full-time job now, and I'm not getting any of my regular work done. But what's most important, I think, is because we're a grocery anchored shopping center, we have essential business, and we have business that has to operate. So we have employees who have to be operable at the same time. We have always had a business continuity steering committee for as long as I can remember. And we have employees like shopping centers from as far southeast as Miami to as far northwest as Seattle. So everywhere we are, we're looking at different local laws, different state laws, different jurisdictions. And a lot like the way Audrey described her team, we're multifunctional, multifaceted. We brought in subject matter experts years ago from all of the different functions that would help us operate, whether it's a hurricane, a tornado, or something like this. And yes, all of those things have happened in my lifetime at Regency. So what was different this time is we realized very quickly that this was so new. None of us really knew what to do. This wasn't in the incident response plan. It wasn't a storm. And we also didn't know what the end would look like and how long it would take. So we formed really a subset of the committee, what we're calling our Reopening Our Offices Task Force. There are about a dozen of us, a subset of the overall group. But this time we pulled in field representatives to help us because we don't know everything outside of what's going on in our corporate environment. And so we have boots on the ground in places like LA who can tell us what's going on there. It's been really, really helpful for us. But our focus, probably a lot like all of yours, is to reopen our businesses as quickly as possible, but as safely as possible. And so I should have said that in reverse. It's really primarily as safely as possible. Secondary to that is as quickly as possible. And with 22 different offices, we do not expect that we will all open at the same time. We think that it will be based on whatever the landlord tells us. Even though we are a landlord at our grocery anchored centers, we are a tenant, just like many of you at our own office places. So the landlord, the city, the state, and federal government also using CDC and OSHA guidance, which is really important so that we get the facts right in the playbook, but balance that with what our culture is telling us that our employees want and need.
Okay, great. You know, Chris, you were telling me that you have 2 teams identified as well. Is that correct?
It sort of naturally evolved into 2 teams. One was to, you know, at the beginning, try to make sense of what was going on and the rapid nature of the shutdown. And as mentioned before, we have 120 locations in the US and Canada and one in Great Britain, actually. And our clients are unique in that they are really people seeking some sort of hair restoration or hair replacement. Yes, we do the haircuts too, but it's mostly people who have some level of hair loss who are in the process of getting surgery, perhaps transplant surgery, or come to us on a regular basis for hair system management, you know, as prosthetic type hair systems. And being able to transition our business quickly, explain things to our employees on a personal basis, and then being able to turn around and ask them, and it's a very emotional time, to explain what's going to happen when we don't know to our clients, who many of them count on us to handle their hair, everything. We have some clients who don't touch their own hair because of the needs that they have. And so it's been about how do we handle having 120 centers shut down at the same time while 30,000 people need your services and running at a skeleton crew. So the logistics of all of that have been really managed by HR, legal, facilities, finance, our supply chain to make sure we're getting things to people, getting the PPE and the field management to actually coordinate interaction with the clients. So that's sort of been one team. But at the same time, we saw this early on as saying, you know, at some point this will pass. We all know that, we all believe that, and that sort of having that faith in the future needed to be part of our culture, you know, because we need to be able to look forward to something. And so it was really about defining what the bounce out of the pandemic disruption is for us. And that requires, you know, HR to look at our organization differently, IT different, to look at processes differently, operations, et cetera, and legal helping us to find waivers, operating waivers where appropriate with the governors and in Canada. So we've had a lot of sort of commingling of these teams, but they're really both essential to saying, okay, what's the present state, but how do we get out of this? How do we have some sort of, how do we create a place where people are encouraged to come back, to know that, you know, this hasn't decimated the business in a very extreme way for some folks. So being able to have that trajectory back to normalcy is something that's important to reopen.
Yeah, and it's an evolution in real time for certain. Melissa, because of your global footprint at Citrix, you've been involved since December and maybe earlier than some of the rest of us. So can you describe that evolution and your journey since then?
Melissa, you're on mute.
Oh, mute.
And let's get off mute.
we go.
So thanks, Angie, and glad to be part of this team. So we definitely, we're global. We're in about 45 plus countries, and we have a team that's built together with our business continuity group, as well as, you know, HR is on it, and our facilities group and our business continuity under legal department is also involved in it. And typically this team, we deal with emergency preparedness as well as then business continuity. And usually as a team, we're able to move pretty nimbly and we can make decisions really quick, because usually the emergency or the incident is something that happens relatively quick. You know, snowstorm in, you know, a particular location, or hurricanes. So this has been a real challenge for us in the fact that it's a long-term event, as well as it's had impact in all of our offices. So when we started in December, we really looked at it as being minimal impact to us because of our operations in China, and as well the government of China were in the driving seat. We essentially had to just follow the instructions that they provided for us. Then the virus started to moving into Asia, then into India. And in the very beginning, India wasn't impacted that much, and we have large operations there. Once it hit Europe and then quickly into United States, just the depths of the problems were larger and larger. The diversity of the issues, the risk to our employees. We're about 50% of our staff is in the US. And so suddenly this small, nimble team grew and really expanded, so that we could, as my colleagues here had suggested, we had to bring in other parts of the business to try to manage the crisis that was going on. I can definitely say moving people out of offices is much easier than bringing them back in, and especially now because of the requirements under the CDC. We also follow the World Health Organization, as well as the local and regional and country requirements. So the focus on this original group, very large expanded group, moved from being taking people out to now bringing people back in, so much so that we have to build a unique plan for each office in each region that we're in. So it's been a challenge. It will continue to be a challenge as we move through these different phases, and as we build teams, break them apart, put them back together again, reorganize them, just to try to meet the needs of the business.
Yeah, and that said, Amy, do you have plans to keep your team in place for the longer term, or maybe you could comment on what kind of lessons that you have learned or are applying for, you know, the future?
Absolutely. Yeah. So not only will the business continuity team stay together, the COVID task force or the reopening our offices task force will have to also. And we're reporting up twice a week. So the smaller task force is reporting to the larger continuity team on a pretty regular basis, as well as our executive committee. And every time there's a change, which is almost weekly because we're in so many different states, then we're reporting what those changes look like. What I didn't really go into when you asked me is, what does that playbook look like? And so it really operates a lot like a checklist. We would anticipate that as we're starting to work through the phases, we'll have a soft opening, which is very voluntary, and then we'll have another phase of an opening, which is a little bit more encouraged, but still voluntary, until we finally get everybody back to what new normal looks like. There's a good chance that we will reverse. We will go backward if there is a spike, or if there is any reason that we need to reassess. So that task force will be critical in helping us make those decisions.
And Chris, what's your take on the continuity of your teams? Do you anticipate that they'll continue, or what does the future look like for those teams?
Well, for a while, it's similar to what Amy said. We have to track the health of our organization, the people in it, to make sure if there's any if there are any places that spike again, and be prepared to close down or change operations if possible. But I think the main thrust is this recovery team and what we're discovering about our business. It's given us an opportunity to take a fresh look. I mean, prior to COVID-19, most of us were looking at some sort of way to evolve our businesses anyway. And I think for us, we've just embraced as a culture the opportunity to really accelerate transformation and create that safety to do so in this new environment. So I think the recovery team will kind of morph into a transformation team in the future.
And certainly that transformation will evolve more quickly once we start the safe return back into offices. Stephanie, I'd like to go to the next slide and we can address the next topic here, which is ensuring the offices are safe for the return. In the same Fortune survey that I referenced earlier, 27% of the CEOs estimated that the time that they felt that it would take to get 90% of their employees to return to their usual workplace would not happen until September of this year. What's more surprising though is 38% of them said that they didn't feel like it was going to happen until June of 2021. Obviously, we know that safe return is governed by the adherence to the criteria put forth by federal and local officials, as the panelists have described their plans for that. But part of the criteria also includes the application of social distancing. And it's perhaps most visible right now to us in restaurants and aircraft with tables and seats removed or taped off, or in the aisles of grocery stores as we're shopping and there's directional arrows on the floor. But to the panel, I'm curious if a remote or distance workforce model has spurred creativity beyond what is usual for your organization, or how are you thinking about your office spaces, and if you, in your view, it's possible to create a physical workspace with social distancing. So Audrey, I'd like to go to you. How are you reinventing your physical workspaces for the return, or is that something that you're planning for?
Well, it's a great question. I think I mentioned earlier when I was talking a little bit about kind of our approach from a task force perspective. The organization of Pediatric Associates has largely been an on-site workforce. We've had minimal to no remote work really happening. So I think that's going to be the biggest change for our organization, is kind of innovating around that, leveraging technology, making sure that our people that are working from, a different environment have the tools and resources that they need. So while that may not sound very inventive to some organizations, I'm sure that there are many companies, in the Miami area that are similar to us, where we relied on our physical workspace. That's how people worked, collaborated, meetings occurred, and we have now fully deployed to remote. We're leveraging technology to keep in touch with each other, to have video conversations just like we are right now. And I think that that is, for a subset of our employee base, going to remain the same. We're going to be able to, deploy some of our work teams remotely. But for those folks that we are going to be asking to come back in the office physically due to the work that they do or the requirement of the job, we definitely are going to be seeing some changes to their physical workspace. I think part of our readiness is really just to challenge ourselves and our thinking and respond with what we believe are innovative ways to approach our physical workspaces, whether that's breaking up some of our current cubes to create more space and enhanced work areas, to broaden some of our conference rooms so you can get 5, 8, 7, 10 people in a room safely, with still allowing them to collaborate in person, but also giving enough space that they are able to do the social distancing that's going to be required for a period of time. So we're definitely looking at what I'm going to call unimagined office protocols that we just haven't had to think about in the past. How do we keep our offices clean, ensure that the training that we're putting in place, not only for our pediatric office employees, but also for our business office employees, ensure that we're promoting, healthy hygiene and safety. We're encouraging and supporting social distancing, which is going to require us as an employer to definitely move things around in our physical space to give them that space. We can't, support it without providing them an environment that does the same thing we're asking them to do. So we're going to be using a tiered and staggered approach to returning those employees that we do intend to bring back in the office, similar to what Amy said, kind of a soft. Frankly, Pediatric Associates is an essential healthcare business. So we have not mandated that anyone work from home. We have not mandated that no one come in the office. So we're going to call that a soft reopening as well, and invite people that would like to come back into the office in June. But we're going to be somewhat prescriptive simply because as we do look at our physical space, we want to make sure that we are bringing people in a staggered way where we're not over popularizing one area over another. And so we're definitely looking at our office layouts and plans and those diagrams to make sure that, you know, if we want to bring in, let's say 25% of our workforce, what does that look like for each other area that needs to be on site to support the work they're doing? What type of conference rooms may they need? Where do we have supplies? How can they get to them easily without kind of creating a bottleneck as people try to get to that? Same thing for our office break rooms. You know, how can we make sure that people that are on site are able to get to the break rooms, but we don't have more people in those break rooms than we want? How are we going to be cleaning the break rooms in between, keeping office stations and worktops, you know, clean and hygienic? So definitely working through, you know, a lot of those needs that our employees have that we then can feel confident as an employer, you know, we're keeping them safe and we're putting them in an environment that will allow for excellent collaboration, but, you know, business continuity, but also safety.
Amy, I know that we were talking and you have a rather large workforce that is office based. What are the considerations or challenges you're dealing with for the safe return to an office setting for your folks at Regency centers?
Well, it's sort of ironic. We just have redesigned many of our offices, including the corporate headquarters, and created what feels like a semi-open environment. It's not fully open. It's not hoteling or anything like that, but it's pretty open. And so it was fresh enough that we were able to go back to the architects that helped us design it and say, now how do we fit, you know, how do we fit everyone in, but with more distance between them, when we had designed it in a way that everyone was very close, very collaborative, intentionally close together. I have to laugh about that now, but they've been terrific in helping us understand we don't have to go all the way back to the way that it was, and we don't have to design new offices, but we do have to be really careful about where we put employees in the interim while we're creating those 6-foot spaces. So our phasing plan will help some of that, and the phasing will require really every other person not to be there. So on average, 1/3 to 1/2 of the workforce can be in the offices together. The other thing that we're doing differently is taking a lot of those meeting spaces that were designed intentionally for training, face-to-face workshops, big meetings with 20 or more people, and reinventing those to make more of the space, understanding that now we've learned from technology and we've learned that we can be very collaborative. I know that my team, even the HR team, talks more today than we did when we were all in the office together, because it's deliberate and it's planned and it's organized. And so it has changed the way we think about work, and some of the spontaneity is a little bit different, but we are optimistic that we will make the space work, and over the long haul be back to something that is suitable long-term, but also doesn't have us sitting on top of each other.
Yeah, that's great. Chris, I know when we were talking about this, you mentioned some considerations that you're dealing with in you know, bringing back workforce to Hair Club, although some have, you know, kind of never left. Can you talk to us about what you're thinking about now?
I think the social distancing idea is really a challenge when, if you think about it, most of our work is focused on the top of a person's head, you know, and being able to have the proper social distance. And about 80% of our employees actually work in those environments. So, I mean, the PPE challenges and all that sort of stuff. But I think overall, the team's done a great job adjusting client schedules, adding a 15-minute sanitizing session between every client appointment, you know, face shields, disposable capes, gloves, masks, all that stuff is in place. I think the bigger challenge is our clients and our employees feeling safe to come back into the environment itself, and what we can do to encourage that. And so it's really about showing videos about that we're clean and showing how we clean, et cetera, to really encourage that, you know, sort of certified clean approach. And we've taken a lot of cues from, organizations like Audrey's, in the medical environment. What are they doing? Because they need to be very clean. Or dental offices, what do they need to be very, very clean because of their proximity and hands-on nature from a social distancing perspective with their interactions with their clients. So I think that's the challenge we face the most, is just giving people that sense of security, that it's okay to come back. And actually for us, we've got about 30 centers that are in some stage of reopen or are reopening, so we can test those protocols and see how people react, both from an employee perspective and from a client perspective.
Oh, very good. Melissa, I'd like to ask you, what's the feeling around the employee population at Citrix, and how are you addressing the safe return in your environment?
It's a really good question. Citrix has a long history of, people working from home, but we're still stuck in a lot of thought of different managers that you needed to have the employee there to be effective. And so that myth has been debunked, and we're able to have the vast majority of our staff work from home. That being said, now bringing them back is a bigger issue, because there's still childcare issues that our employees are facing. There's people that prefer working from home and they don't want to go back into the office. There's way more requirements now to bring people in. So when we look at having to do temperature checking and having people wear masks and the social distancing, these are all just really obligations that a lot of our employees are not 100% on board with. So what we have is 4 tiers of types of offices. So we have our tier 1 offices down to tier 4, and then within these offices, we're trying to get our tier 1 offices open. These are our largest sites. These are the most business critical sites, and so we have a 4-phased approach. The first phase being essential workers only, second phase being bringing in people that are more effective in the office because of their job roles, and then bringing in 50%, and then on to getting the offices fully staffed. This is probably going to take us about 18 months to become fully staffed again. And the amount of work that's being done in the physical sites is enormous, from all of the traffic control of getting people in, the staggered starts, which has been mentioned before, as well as in our India offices, we have 300 cabs that take people home into the office every day, and having the cab set up for social distancing. And so it really is going to take us quite a while before we get everyone back in the office. But overall, employee safety is most important. And we're not making people come back. If they're not comfortable coming back to the office for any reason, we're going to let them work from home.
That's a really, I think, appropriate response. There are so many different ideas about, what is safe, and it becomes a personal kind of consideration. So now for the $1 million question, and that is, what's next? And Stephanie, you can go to the next slide for this one. We are headed towards some version of Office plus virtual, I think, for the majority of organizations that haven't experienced that before. As you said, Melissa, they're going to be experiencing it now, at least for a transition sort of a phase. And so we all just, got a quick tutorial in being remote workers. And, some of us deal with that better than others, but I think erased is the notion that virtual doesn't work and we can't quickly adapt to some other sort of model, but it doesn't mean that it's right for everyone. And we don't necessarily have to be a technology organization to be able to function in this way. But as HR leaders, we know that we're at the heart of navigating that change, and change is a mindset above anything else. So the culture and the values of the organization and shared by the employees across the organization are really influencing their decision making and their behaviors and their comfort level around coming back into the office. So, Chris, I'd like to pose this question to you. What's in your plans to address the employee mindset, especially when it comes to that psychological safety, fostering engagement and that comfort to return?
I think the main thing is just being respectful of people's point of view on this to start with. I mean, we've done I think a decent job engaging our employees while they're home. A good number of our employees, the vast majority, are hourly, so they're on unemployment because they're just not able to come into work. So, but we still have been paying for their health insurance benefits along the way. We've still been maintaining as much of the benefit support as we possibly can. Some have used their PTO, et cetera. We're doing everything we can to make it as easy for them as possible while we're shut down. Knowing that nothing about this makes sense to a lot of people, right? So I think that's an important part of feeling secure about coming back to work. Did the company do what they were supposed to do during this process? So how can I trust them going forward? I think that's a cultural point as you talk out, and a very important part of our HR process. So we answer a lot of questions about benefits and what's open, and also realize that some people may not want to come back, and that's going to be okay too. And at some point there's going to as I mentioned before, our business requires people touching people's heads, and you can't provide a service without doing that. And if someone is reluctant to come back for those jobs, that's okay, and we respect that. But we know that people have they may live with aging parents who are high risk and they don't want to be carriers. We have people who might be pregnant. We have people with children with health issues also. So there's all these sort of connections that we have to really understand about our employees, and almost on that individual level. So we're doing the best we can to do that, but also it's that idea of reassurance that things are going to be okay. Maybe not the same as what they were, but they're going to be okay going forward. And that's the most important part for our managers, particularly our center managers, to really have that engaged communication with both our employees and our clients to reassure that things are going to be okay. And here's what we're doing to make sure the things that are in our control that we're doing to reassure that things are going to be okay.
That's a really important point, Chris. And Amy, I wanted to ask you the same kind of question. What's happening at Regency centers in terms of ensuring that psychological safety, or trying to gauge or prepare for the engagement level of the employees as they do come back?
Yeah, I mean, it's tough. We feel like we're communicating a lot about how important it is that employees feel safe. I'm not sure that it's ever enough. We have town hall meetings and surveys and all of the kinds of communication channels you can think of to be able to pull that information in and then share back out, that we really do want this to feel voluntary. A lot of that is because of what we're hearing from the employees and the understanding that not everyone will feel comfortable coming back. Some of the other kinds of things that we're trying to remind people of along the way are, we have an EAP. It is free. It's free to the employees and to their family members, even extended family. If teletherapy is necessary, do it. It's free. We are encouraging people to use their really, really generous PTO buckets right now. Even if you can't really go anywhere, take a day off, take a mental health day. It's okay. We want you to recharge and feel comfortable doing that. And so much of what I think works for us is just tone at the top. It's coming from our CEO. I can't say enough about how normal she is. That's kind of the best way I can describe her. She's just a regular person, and she's the first one on her Monday, Wednesday, Friday emails to email the whole company and say, look, I took my dog for a walk. It's okay. Or, I had to take a break and feel like I needed to walk outside and get some air. It's okay. So I think having that happen makes people feel like it really is okay. And otherwise, it's just something we put on a poster.
Chris, you mentioned something earlier in your comments about kind of the reskilling of people, or if some are not comfortable with coming back. Maybe there are some that would be inclined to do something different when they do come back. Do you see reskilling needed to return to kind of the future? Or maybe it's connected to the evolution that your organization has faced already anyway?
Yeah, I think what's, again, for us is that we look at this as a fresh opportunity to step back and look at how we can better serve our employees and our clients. And one of the things we discovered is that while most of the services we provide, as I've mentioned, are in the center and they're hands-on, the opportunity to do things virtually is actually something that is a rather new area for us, not just from a potential sales perspective, but actually from a service perspective, to actually be able to better serve a client at home. And you'd be surprised, we're servicing a lot of, we have people who wear the hair systems, have to have them changed every so often, and it's important. It's a medical, we're not medical providers, but it can create a medical situation if their scalps aren't cleaned and their hair systems aren't changed. They can get rashes, etc. And so we have discovered a way to provide pre-cut hair to our clients and actually walk them through virtually how to install them at home. Now, they're not perfect solutions, but they help them, those clients, for now, right? So how do we learn from that and actually help our clients into the future from that virtual experience perspective is really an opportunity for us. So it's different, and hopefully what we learn is that if something like this happens again, we won't be as dramatically impacted as an organization from this learning. It's sort of, we've been there, done that. We know how to handle it in the future.
Wow. I want to go to the next question here, because something that was mentioned earlier leads me to this, and I want to go back to kind of the communication subject. I think, Amy, you were the one that was talking about the amount of communication that you've been doing in your organization. But we are in the midst of an unprecedented period of reactivity, I think, but also exercising at the same time flexibility and agility, like you have described, Chris, and with still, so much uncertainty out there and so many different directions of how to come back, and based on geography and circumstance and municipality and individual kind of comfort level, it's difficult to fathom establishing rules and policy changes, much less anticipate, what is the future and what do we communicate to our employees on any given day. So I'd like to ask the panel, what's working with your communication strategy in this fluid environment, and have you determined anything really in the short amount of experience that we have that you need more of or less of as a part of that communication strategy? Audrey, I'd like to start with you and get your thoughts on this.
Thank you. Well, certainly, the first thing that I'll say is that for all of us, there has been so much information that the media, local government, the federal government, our state government, the CDC, OSHA, so many different organizations have done their best to try to provide as much information for not only, those of us working in a business environment or in an employer environment, but also at home. And one area that we've really tried to focus on is helping our teams to kind of make sense of that. We can't fully interpret what each of these, agencies or organizations is trying to share, but we can try to take and synthesize what's been shared, how it's relevant for them, what it means for us in our work environment, what it means for healthcare, and how we can use what's been shared as kind of a gift, so to speak, of education that we can use to keep our teams safe, to keep our environment safe, to further create an environment for our patients and their families to be safe as well. So I believe that our communication strategy at PA has been excellent. I mean, I'm very proud of the work the team has done. We have an excellent marketing department. Our leadership and our management has been very engaged and very involved in making sure that our teams get the information that they need in the time they need it. So it's been constant. It's been, evolving since day one. And we've really tried to remain fluid and kind of navigate with the twists and turns and new information. one thing that we've definitely done is we've tried to take information that we've been given and kind of take that and morph it into new protocols, into ways that employees can understand, how their actions in the workplace kind of impact others, impact patients, and how they can, help to remain even more safe than we may have been pre-COVID-19. And so that evolving situation has certainly kept us on our toes. And I feel like we've been able to implement some very, helpful new protocols and that make our employees feel safe. And I think they also are feeling a level of comfort and trust. We talked about that a little bit earlier, that psychological well-being, that we're on top of it. We're keeping on top of the information that's out there, and we're sharing with them relevant information on, a weekly and often a daily basis. And we're using a lot of different modes for that communication. We're doing everything from town halls, text messages, emails, information on our internal intranet. We're passing information down kind of in a cascading fashion where we'll meet with, say, a director base, and we'll bring out, new clinical information that then gets cascaded down to teams. And that information is kind of flowing back and forth. We just, have really made an effort to make sure that the communication that we are putting together is getting to every employee in the organization, because at a time like we're dealing with right now, it's critical that we are all on the same page and that everyone understands what is either new in the environment, has changed in the environment, and how they can remain safe and use these protocols to keep our patients and our environment safe as well. So I would say that constant communication that is consistent and has themes, so people can kind of continue to see that here's what's changing, here's what's not changing, here's how we can further keep ourselves and our patients safe, and here are some of the things we were doing, yesterday or last week that we no longer are doing, and here's the change to it. Showing them and helping them to make sense of the change has really been a big effort in our communication.
That's amazing advice and great comments there about what's working. Amy, at Regency Centers, what's really working with your communication strategy? I know you mentioned you're doing a lot of it. So how's it going for you?
Well, I really can't say it much better than Audrey just did. It's constant, it's consistent, it's predictable. People know what to expect and when to expect it. I will say early on, we learned a couple of mistakes the hard way. Being very optimistic, we over committed, to some time frames. Even we will have an answer by this date, or we will know something by this week. And we realized we should not do that, because even if we think we know we will have an answer, what if we don't? You can't run the risk of letting people down. So not over promising information even, but saying we will continue to keep you updated. The other thing we did that she mentioned is provide many channels. And so in addition to emails and team meetings and cascading it throughout the organization, we created a page on our banner, and the page is specifically a COVID updates page. And it's everything from how we're communicating to our tenants, to how we could communicate better together, to synthesizing what we're hearing exactly the way she said it. So making information available where it's easy to find was probably the biggest change we made, because we realized all the emails were just getting lost in the shuffle, and someone would ask a question and we thought, we explained that, well, no one's reading all 500 of your emails about the same topic. So marketing was great in helping us put it in a place that people wanted to see it and knew where to find it.
Interesting. Chris, strategy is part of your role there at Hair Club. How is it working with your communication strategy specifically?
I think there's, in addition, sort of building on what Audrey and Amy have said, I think the other part that we discovered is that there's two important things, is that really get into the mode of communicating. Not be, I think prior to COVID-19, we would internally think about all the different gadgets we could use to communicate, as opposed to really getting down to communication, which is, what is it, why does it matter, and what's in it for me? I mean, that's the basic rubric of communication. And, with what we're finding is, of all the technologies that we have and all the strategies to communicate, still the most important tool is the telephone. You can have team posts, texting, emails. At the end of the day, sometimes you just jump on a 5 or 10 minute phone call to resolve an issue right then on the spot. And it's something that's been lost in our pre-COVID-19 world that did you catch the memo? Did you see the newsletter? You know, just pick up the phone, and teams and sites like that make it easy to just click a button and get everybody on a call really fast. And so I think that's one of the things we've discovered is that, okay, there's a lot of confusion here. 5-minute call, 10-minute call. I have one leader here calls it a martini call or a shot call. Which one is it? You know, and that really helps, you know, close the loop on communication when you do that, which is the really important focus here, is closing the loop.
I think best takeaway of the day, I'm going to have those shot calls. That's amazing. Melissa, I'd love to hear from you on this topic. You know, technology is your bailiwick, but you know, how does communication happen inside Citrix?
Yeah, you know, a lot's been mentioned. You know, multiple channels is really important. Having our executive leadership team speak up and speak out. You know, putting a face in front of the employees about how it's impacting them personally has been really effective for us. The only thing that hasn't been mentioned is in what we've been doing with our communications is we've been surveying our staff about once a month. And so we go straight to give these, pulse surveys, and we just talk to the employees and say, what are we missing? What would you like to hear more about? And so we really have them help push up from the bottom what other topics that they're looking to build on or that we can respond to. So that's another tool that we've used to help communication across the organization.
Well, that's a perfect lead in to our next topic. And Stephanie, if you want to go to the next slide, you know, we talk about really surveying the employees and tapping into their mindset. I want to turn towards the topic of engaging with the workforce now. The top concern and business risk for the CEOs in the Fortune survey that I've been mentioning is keeping employees safe and productively employed, with 97% of those responding to that effect, that is their top concern. So pretty much everybody agrees there. Leadership is more important than ever now. Yet, you know, our leaders, and I definitely, in the organizations that I work with, are really overtasked with a lot of reactionary plans, you know, challenge to maintain business continuity, and in some cases, just really hanging on and working to salvage, you know, pieces of their core business. But still, there are a lot of stories of really great triumph amidst the chaos and uncertainty, and I think we're seeing more and more of those come to fruition. So my question to the panel is, what defines great leadership in the environment that we have today, and what examples have you experienced firsthand that have been inspiring? And Chris, I'd like to start with you.
I think one of the observations I've made is that, you know, we are in we're dealing with I'm dealing with our employees in particular. There's so much that feels out of our control, right? And so leaders who can master their change management skills, that maybe wasn't a strength for them, but it's important because in change management, you have to set a vision that people are willing to follow, right? And help people feel safe in following that vision. And I think that on a regular basis, that's really important. There's one particular leader here colleague who was new to the organization before the pandemic, and she inherited a part of the business that needed significant change, almost to the point of a reboot. And her approach is letting each person say what they have to say about what they would want to see different, even if it was 100% off script, even if it was 100% wrong. Being able to let people say what they have to say and contribute in the way they want to contribute, to be part of something that moves us forward, is part of a change management skill set, part of a visionary leader skill set. And I think that is one of the things that I've noticed, is that how then her team has gravitated toward into a different type of alignment on improving the business processes that need to be improved. So I think that idea of, we already knew it was there, but now it's more important. I guess.
Yeah, I would agree with that. Amy, you told me a really neat story about your CEO. Would you like to share that with the audience now?
Yes, I will. So, and I will add, I've been blessed to work for some of the greatest leaders that are out there. So, our former CEO for 40 plus years, whose parents founded our company, was a wonderful, warm, very caring person. All of these people seem to have really strong emotional intelligence, which has been great for me. Our new CEO and president has been at the company about as long as I have, almost 25 years, and was just named the CEO in January when all of this happened a couple months later. And what's interesting to me is she really has not had to change anything that she does. She's so personable and so warm and so relatable that it doesn't feel like it's because of the crisis, if that makes sense. So one of the things that I shared with Angie that she has done as long as I've known her, even when she was CFO, is she calls every employee on their birthday. And she explained it to me like this. She calls them on their birthday because it's one day that she knows that she can get them on the phone and not have to talk about work. It can't be about work. She forbids them to talk about work, but each employee will get a phone call. Most of them are scared to death to take it the first time. She has called people before they've even started working for us if their birthday was on Sunday before their hire date. So hopefully that's not breaking a law, but she insists that they tell her something about themselves and something they're doing to celebrate their birthdays. And I promise you, she knows more than I do about all of our employees and about what's going on in their lives and what kind of people they are, what their hobbies are, what their families are like. And so when there are things like a crisis that occur, it doesn't feel fake. It feels like that's who she is already. And so employees already know who she is for who she was before things got really serious and difficult.
I think it's a wonderful story, and we were just talking, some of my team members and me this morning about how we as a team have gotten to know each other so much more just over the last couple of months, and we've been working together for years. But I think that's something that's really important because it does help us all feel connected to the work that we do, the reason why we do it, and it helps us all, stay engaged as a workforce and really deal with all of the changes that have happened. It's an important time, I think, to Chris's point, to support the growth of leaders into the future, and we should always be doing that regardless of what's happening. But I think now it's more important than ever. So, Melissa, I was wondering if you might weigh in on this and just give us your point of view on supporting the growth of leaders into the future and what that might look like.
Yeah, right off in the beginning of the pandemic, one of our discussions was how are we going to help our managers, because they're going to be sort of a sandwich between the executive leaders and these different disaster teams that were working, and then they have their team, that they need to manage and hopefully keep productivity up. So one of the first things we did was to try to relieve some of the stress was we kept everyone on the payroll until May 31st, including contractors and temp staff, and just kept everybody on full salary, whether they could work or not work. And so that alleviated the managers, at least with having their staff feeling financial stress at this particular time. And then it's what we've really been trying to focus on is helping them imagine the unimaginable, right? Being able to, how are we going to, as a manager, keep productive when people are dealing with so many pressures in their personal lives? And so we kind of came back to some of those tried and true management development topics, like crisis management, being able to have really good conversations with your employees, but also prioritization, change management, and of course, going back to how do you manage remotely? One of the big concerns is that the longer this goes on, the people's engagement drops. And so how do we avoid that? And how do we help our managers be able to deal with that as they see that happening in real life? So for us, the key is being able to do management development and being able to help our managers then manage their teams.
And Chris, I think you had also an interesting perspective on this. What is your viewpoint on growing leaders for what's next?
Well, it's for us, we kind of flipped it around. It's not the growth of leaders, it's do our leaders understand what it takes to grow? Because to come out of this, we're going to have some sort of growth trajectory, not to get to a new normal, but to get to the normal we want to have, right? Setting our own destination, not surrendering to the idea, well, it's the new normal. It's still the future we want to create, and how do we have leaders understand what it takes and to achieve growth, and how to hold people properly accountable in that new existence of growth. And so I think that's where we're spending a lot of time, of getting clarity about what it's going to take us to grow. And I think the leadership traits will follow after that.
And I think that's an excellent comment and point of view to kind of wrap up this discussion before we take some questions. The good news is I do feel confident that, you know, leadership is strong and behind this effort, and really, you know, setting our organizations and our employees up for success in terms of feeling comfortable to return as we continue to transition in this climate that we have, and define, you know, what is next for us. So I want to thank the amazing panel for your insights on the questions that we had planned. And as you were talking, many questions are coming in from our viewers and our listeners. So we want to field some of those. So I do have a question that kind of relates to this topic of engagement and skill sets as leaders. And the question is, as industry leaders, what skills would you want to see in new graduates? What updates to university and academic curriculums for workforce-related programs do you think would be good? So is there someone on the panel that might tackle that? Or maybe I ask that to Alpanya.
I think that the industry leaders would be great resources for that. I'm on the other end of that, wanting with a graduating class of 6,000 that we just graduated at FIU. I'm looking for places for them to go. So I'd love to hear from the industry leaders.
Well, this is Audrey. I don't know if you can hear me.
Yes.
You know, I think that, you know, one of the things that I have seen in our workforce that I don't know how you teach this in school, but I definitely think that resiliency and innovation, those two things have helped us to navigate this kind of unprecedented time in big ways. I think if we can teach, you know, young students to navigate in an environment that isn't really well mapped for them, how can they, you know, complete investigation? How can they ensure that they're following protocol, but also bringing appropriately innovative ideas to the forefront? You know, these are people who maybe haven't worked in an office environment yet, and they may have some great ideas for us that we might not have considered. So I think resiliency and using kind of that innovative spirit for the betterment of the organization are two things that I'd love to see, you know, built into more business programs, any program really.
Yeah, great response. Any other thoughts from anyone else on the panel to that one?
I mean, I think resourcefulness, you know, it's sort of like one of those traits that are a little bit hard to measure, but in a time where we're doing things that we weren't expecting to do 4 months ago, being resourceful and being able to take limited resources and you know, use them effectively is really a key to the future.
Yeah. Audrey, I got a question specifically addressed to you. This is from Sebastian. You talked about a tiered approach to returning people to the office, starting with 25% of the team. Any recommendations on who to prioritize, and will employees have an option to stay home? And what about people who ask to return?
Mm-hmm. So those are all great questions. And I think that one of the things in that tiered approach that we're going to be looking at is which roles on our team are best equipped for on-site work. That's really going to be the team that we'll probably focus on in the beginning. As I mentioned earlier, we're not requiring at this point anyone to come into the office, but when we do get to the point where we do want to fold back in to, you know, a productive and healthy business office site, how can we get them back to work? We're going to be looking to those teams to return, that it's more difficult for them to operate in a remote environment. So that would be the first team that we would really look at. They may, and it may be because they need more technology needs than we've been able to provide for them until this point. So into the future, perhaps that, you know, team or that work could be, you know, deployed remotely, but at the moment it's been more difficult for them. So until we can get those, you know, technology protocols and processes in place, we'll look to those that it's the hardest to deploy remotely. And I think that if people want to come back to work, you know, let's just say that we're at a point in a specific area of an office where we're where we want to be for that tier. And now we've got a few people that say, you know, we also want to come back. You know, we don't want anyone to operate and, you know, work in an environment they're not comfortable in. So we'll do our best to accommodate whatever their request is in, you know, in a safe way. It may be that their desk or where they physically report to work may not be identical, but we will do our best to accommodate those requests. Both ways, actually, whether they don't want to come back to the office because they still feel threatened or they're in a high risk category, or they would like to. Did that answer all of the questions? I don't know if that got all Sebastian's.
Yeah, there you go. Several multi-part questions there. There's another kind of related question I'll throw out to the panel. And this has to do more with those physical workspaces and safety. How are you promoting employees to disinfect their own workspace? Is it considered too much to ask for?
Well, for us, for our center operations, that's built into the daily routine now from start to finish. In our offices, in our corporate environment, when we start having people come back, you will get your temperature taken when you walk into the office. There will be hand sanitizer available. The floor has tape arrows all over the place. So even the routing and management of it is there. We have support of, you know, already just kind of been in the office, you know, kind of observing what's going on with the prep. You know, doorknobs are getting cleaned all the time. The supplies are there to clean your, so it's, you know, you can't be over everybody's shoulder all the time. But if we just do the best we can all the time and commit to knowing that we don't want to make others uncomfortable or unsafe, you know, you leave your office, put your mask on. You know, it's just that simple. You know, it's just for the courtesy of others right now.
Yeah. We have a couple of questions that relate to the same topic here, and that is around childcare assistance for staff with young children. Any of the panelists want to comment on plans or things that your organizations have in place to address those concerns?
You know, Angie, this is Audrey, you know, and I, sounds like, you know, that's on the mind of everyone. You know, every day we wake up, we look in the news and camps are being canceled, school is being canceled, any of the after school programs are canceled. And so while I can't tell you that we have a solution, we're definitely working on that aspect of things. And that may even play into our tiered approach and those folks that, you know, may be able to work, you know, remotely, maybe even modified work schedules. We don't know what that looks like yet, but that is absolutely a real concern for our working parents.
Yeah. It's the biggest topic with the return to office strategy that we have going on right now at Citrix. And one is offering different types of leave of absence for our staff, especially in countries that, you know, do not have requirements legally for leave of absence relative to COVID. So that's an area that we're looking at. We're looking at expanded vacation time, looking at helping people with a service that we just started researching, which is in-house daycare, that you would essentially use a service to provide daycare in your house, as well as virtual babysitting. That's also an area that our benefits team is looking into. But it is the #1 issue for this as a company with, with a diverse workforce.
And it is the #1 most frequently asked question in our question box too. I can say
It's tough. It's really, really tough. We've built a society with 2 income earners, and daycare has been a foundation of the working family. So we definitely, pulled that out of the mix is difficult.
Yeah. Another question that we have, sort of unrelated, but has to do again with the physical spaces. It's for those companies that have an office building site and employees who will need to be in an elevator to go to their work areas. How are you preparing for this?
Yeah, we've restricted them. I mean, fortunately, in our most of our offices there's not a lot of floors. So they're restricted to the number of people that can get into the elevator. And so there's a lot of waiting for people. We'll be having to deal with waiting for elevators. So encouraging people to take stairs, also, putting tape on the floor that on the elevators and where people can stand, having the dispensers close to it because of all the touching of the buttons. So it's mostly going to be about restrictions.
Yeah.
And I would add to that too, like I mentioned earlier, we're a tenant in our building. And so we have 35 floors in our corporate headquarters, and we're on 26, 27, and 28. So 250 people all day long will be going up and down just to get to and from work, not including lunch. Some of what we're trying to train around is the reminder that it will take you longer, that there are requirements and there are limits that are specified by the landlord that we agree with. And I'm specifically speaking to Jacksonville, but it's really consistent throughout the country, everywhere that we are. And for that reason, we're also planning to be really flexible with start and stop times so that we can organize throughout the day, even if it means the day is really long from just from an office hour standpoint, so that not everyone's coming and going at the same time and creating a bottleneck.
Yeah, very interesting. All right, so I'm scrolling through some more questions here. Here's another one, kind of just on the maintenance of the facilities. Has your organization added new maintenance duties and sanitary standards that may require looking into changing the compensation, such as implementing additional pay for maintenance staff? Question.
Yeah, we haven't been impacted by that, but we haven't had to change any of the fees or that we pay or that the contractors charge us. We've just had to expand it. So we've ended up paying more as an organization just because of the additional coverage and requirements to meet the different guidelines in all the different communities.
Yeah, no one, excuse me, no one facility of ours is that large that it's that challenging. So really, outside of any additional cleanings that we do to sanitize on a, multiple times a week, just to go through and sanitize space, has been absorbed for the most part by our existing staff.
Go ahead.
I was just gonna say, because we work in a clinical environment and we take care of children, of course, we've done some things. We have made updates and changes to the protocol that we use for cleaning and sanitizing based on regulations, frankly, from the CDC. But I think there's also a couple of other elements there too that just proactively we've done with our HVAC systems. We've got 39 offices, across 40 actually across Florida. And we've made updates to we've put in medical level filters so that we're filtering out, a lot of what's happening in the air and, ensure that we're trying to keep our folks safe. We have done different rotations for our in-office visits. So yeah, we have made some modifications to the way that we clean and sanitize. When we, in our business offices, we've also upped, as similar to what has been said by Melissa, upped our cleaning protocols and our sanitizing. And we've put out, Purell, wash stations throughout the building, anywhere that an employee may go, outside of a break room, the restrooms, getting off of elevators, going into their work department. We've just made sure that cleaning and sanitizing equipment and, resources are available for people that know we're doing a good job, but feel like they would like to do something additional at their workstation as well.
Angie, I do have one thing to add to that. Similarly, I didn't mention this with our phased approach, but in the soft reopening phase, we will assign teams for those who are still coming in voluntarily. You're either an orange team or a blue team, so you're not there on the same weeks. That gives us an opportunity to do that deep cleaning in between teams and not have to do it every single night. So we'll still have our normal cleaning every day, but to do the deep clean between teams meant that we would really have to alternate them.
Mm-hmm. Very good. I have a question here about temperature checks. How do you check employees' temperatures and ensure privacy in the event that you have to send the employee home? Who's doing the temperature screening and checking?
Ours is done by an HR rep as people walk in, and we have the the distance scanning thermometers.
Got it.
Yeah, we've looked at
Go ahead, Melissa. I'm sorry.
Yeah, thank you. We've looked at a lot of different resources there, from providing thermometers to people to having on-site medical staff, at our larger sites, which is very costly, as well as it being required in some of our locations. And, in the beginning, you think it's a pretty quick and easy answer, and that is, oh, we'll have the security or the receptionist. And then when you really start looking at trying to track people's movements, track people into the building, it gets more and more difficult. So we're probably going to have a lot of different solutions there, from people taking it themselves in some of our sites to having it done by hiring a person in the medical profession and or in EMT to assist with it. The issue with the data privacy around people's medical is really something to take serious. We created an app at Citrix that people certify before they leave home, and they'll just answer a list of questions around their travel, their temperature, as well as if they've been around the virus, or if they're taking care of family members with the virus. So they'll certify. We won't keep that information. We won't collect it. The app provides just essentially a color code daily that says this person, cleared these questions, and all we record is whether or not the person certified on the health app. But it is a big issue about trying to keep people's their information private. So we'll end up having holding areas for people that don't want to leave right then, and so that they can take it after about 5 minutes, because other things can impact the temperature than just having the virus. So it is something that we're currently working on.
This area, and really PPE in general, is what we've struggled with the most. And so some of it is because We're not all in an office building where we could even manage this. We don't have HR people everywhere. We thought about nurses. That was a solution, bring in a healthcare professional to do it. But we also have employees at shopping centers on site where they're not necessarily in an office. So their arrival and departure doesn't require them to go through a single point of contact. Another thing is just culturally, our code of conduct is so important. Everything we do centers around trust, and people are our most important resource. And so we felt like if we couldn't trust our employees to take their temperature at home and self-assess before they left, never showing up with a temperature, then we would have other political battles to face. So we are taking that approach today. Today it is strictly honor system without a jazzy app. It's just an assessment that we created as a questionnaire. And again, like she said, like Melissa said, taking legal advice about how to do it right. We didn't feel comfortable that we could do that everywhere. So we're doing it this way for now.
Thank you. I know we're coming to the end of our time here, and I want to be respectful of that. The questions are still pouring in. I feel like there's probably a part 2 to this that we need to address, but I want to thank the amazing panel for your insights and your comments. It's been a pleasure to work with all of you in preparing this discussion today. I'm going to send this back to the chamber for closing remarks.
Yes, that would be me. Thank you, Angie.
You're welcome.
Yeah, no, thank you very much, Angie, and to all the panelists, and a special thank you to Right Management and Tammy Davidson for helping us all get this together. Tammy has been a vital part of our committee, and as always, she's always been someone we've been able to lean on in putting these things together. A special thanks also to Career Source of South Florida. It was great to have them as a sponsor, and really great to see Rick Beasley join us earlier in the panel as well. There's been some reference as to a need for a part 2. And, we were talking about this before even today's session started. And it certainly, some of the questions, a lot of the legal questions have pushed us to say, yes, most definitely we're going to have a part 2 and bring in some lawyers like myself involved to answer some of your questions, like the temperature check is something that I'm talking to my law firm about now. And it's not so much whether you can do it, it's just how you go about doing it. That's getting a lot of people tripped up. And certainly, there's been a lot of questions about liability, and both in terms of, not just employees, but just clients as well. So I think we'll definitely benefit from having a part 2 and getting some of the legal questions that we weren't able to get to today answered. And we'll definitely send out information to everyone so that we know the timing of it. But we've been pretty good about doing these on a weekly or maybe even bi-weekly basis. So we'll be having one of those soon. I can't end this without thanking Stephanie Parra, who has also been such a great part of our committee. She is the person who actually runs this thing and makes El Pania and I look so good. And thank again for a really great panel. And Stephanie was certainly key to providing this opportunity for all this great information we've been able to share today. But yep, thanks to everyone involved, and let's keep an eye out for part 2 and definitely have a continuing discussion of these valuable issues and these issues and the valuable information that we can all share with each other. Thanks again, everybody. Bye.